And I know better than anybody else that he can stop and start and change direction better than anybody else in the world because I played against him every day in practice in one-on-ones. He was on that side of the ball in offense, and he was the guy I would cover on the inside of the slot, and he absolutely routed me up day after day, week after week, month after month. He was very quick, and I had a very hard time covering him. And his superpower was how quick he was.
Yeah, straight A student, but I'm friends with the cool kids. Following the rules and the rubric. Freestyle on the bus.
I don't know. It's a helpful lifelong class though. It like really is.
Mass transfer is a helpful lifelong class.
I
Tell
know
me
it doesn't
how mass
sound
transfer is a helpful lifelong class.
it doesn't sound like it makes sense, but like when you're just walking through your like everyday life, you think of things having to do with mass transfer way more than you could ever imagine.
Okay, I understand that like you can see it outside in the world more, but how does it make it a helpful lifelong class? How is it going to outside if you need to apply it in your specific profession and specific instance, which I don't know if that's true or not, but I would assume you don't actually need to apply mass transfer capabilities on a regular basis as a pediatric oncologist. Maybe there's some underlying principles that apply there, but outside of specific professional instances, how is mass transfer a helpful lifelong class?
I really think it's just good to know what's going on around you. Like to
Okay.
me, that's beneficial. And
Okay.
I would argue that it has a lot to do with pediatric oncology.
Okay. Well,
Like chemotherapy is all mass transfer.
yes, but I understand that, but I think that when you actually get down to the day-to-day of being a pediatric oncologist, you're not gonna think about the mechanics of mass transfer on a daily basis. That's why I say underlying principles, yes, I think that's important, like, people out there need to know it, but I don't think it's going to be something that specifically applies to your day-to-day, um, cognitive capacity. Now, if there's a pediatric oncologist out there who listens to this or, you wanna tell me I'm wrong, I know nothing about this, so I'm not claiming to be right, but I would just assume that's one of those things that, is more like background knowledge you need to have at the beginning, but then it becomes, something that you just apply through more specific tactics later on. I will refute I refuse to believe that this is something that's a lifelong helpful skill. Um, but yeah,
We'll
I
see.
mean,
I'll live a life and report back. So
okay, yeah, let me know. You guys only have to wait like another 80 years or so, and then we'll find out whether mass transfer actually had a meaningful impact outside of John's professional career. Okay, let's get into the questions for this one, and then
so
we'll take it from there. Yeah, go ahead. What you got
awesome.
for me?
I just want to start out with this first one. It really caught my attention as we saw it coming through, and it is talking about lifting weights and then just kind of how that's going to relate to everything else. So the question is, I am scared that lifting weights is going to make me bulky and slow. Is that true, Doctor, Mister Coach, Sir, Zach Geiser, Sir?
Oh, I love that they included the doctor, Mr. Coach, that, but they didn't actually include that, did they, John?
No, that was just me.
Oh, okay. Yeah, the answer is yes. Do not lift weights or you will get very bulky and very slow. Next question, please.
Yeah, 100%.
No. Okay. So, yeah, that's actually a very common thought, common concern that you have for people that people have. So, no, lifting weights and getting too bulky and getting too slow are not things that necessarily go hand in hand. So you can lift weights and stay lean, and you can get very fast. Lifting weights, getting stronger is the best way for you to get faster. So it's actually the opposite of what your question is. And as far as getting bulky, you have to be very intentional about adding mass. You're not going to accidentally turn into Phil Heath or Sebum. You're not going to accidentally turn into one of these huge jacked individuals because you lifted a couple of weights. No, you're going to have to dedicate your entire life, every single waking hour that you have, in order to gain that amount of mass. Like you have to be extraordinarily locked in, eating an absurd amount of calories in order to actually get quote unquote bulky. So lifting weights in and of itself is not going to probably not really going to add much mass to you at all. That's more so going to be the diet side of things. You'll add muscle mass, but overall mass, it's not going to make that big of a dent. So no, there is absolutely no reason to be concerned that you're going to get bulky and slow because you're lifting weights. Quite the opposite, actually. You're going to get significantly faster if you're lifting weights in an appropriate manner, and you can stay lean. We talked about relative strength a lot last episode, so we can refer back to that one. But yeah, so absolutely no reason to be concerned about that. I don't know. Is there anything else I should address with that?
No, I mean, I've been trying to get bulky for 2 to 3 years now, and it hasn't worked yet, so I don't think this person has to worry.
Yeah, no, I've been lifting weights for a long time, and I've still got absolutely string bean biceps, and so, yeah, I think they'll be good.
Yeah, I would agree. Alright, jumping into this next one. This one reads, I'm one of the smallest guys on the team, and they're curious about what the best way to train to get stronger without just getting bigger is. They ask, should I focus more on strength or on being faster than everyone else?
Okay. I like it. So I guess this would be a good time to have a conversation about superpowers versus kryptonite. So if you're one of the smallest guys on the team, I'm assuming right now speed is your superpower. You are probably, if you're playing at a decent level, speed is probably the thing that you excel at. And so we would call that your superpower. Your kryptonite would be your size or your strength. And so that's the thing that is your biggest weakness right now. What happens a lot of the time is people over index on developing their weaknesses. They over index on getting rid of their kryptonite and they under index on their superpowers. An example I'll use here is a guy that I played college football with when we talk about superpowers. His name was Jojo Natson. He played in the NFL for, I think, like 4 or 5 years. He was a very, very good athlete, but he was very, very small. I want to say he was listed at like 5'6", 160 when he was on the Browns and the Rams, when he was
Wow.
on their rosters. And he might have even been smaller than that. I don't know for sure. He might have been listed a little heavier, but he was a small individual regardless. He was fast in a straight line, but he wasn't like world class fast in a straight line. He was like a 4.49 or something like that is what he ran at his pro day. He was relatively strong. He threw up 225 for a few times on his 225 bench test at his pro day. But the
Mhm.
thing he was exceptional at was he could stop and start faster than anybody else I've ever seen in my entire life. And so he was a slot receiver and a punt returner. That's how he kind of made his living in the league. Was he was a very good returner. And I know better than anybody else that he can stop and start and change direction better than anybody else in the world because I played him against him every day in practice in one-on-ones. He was on that side of the ball in offense, and he was the guy I would cover on the inside of the slot, and he absolutely routed me up day after day, week after week, month after month. He was very quick, and I had a very hard time covering him. And his superpower was how quick he was. He brought everything else up to where it was at a level that it was good enough and acceptable enough to meet the bare minimum standards, or at least meet the bare minimum standards. I'm not saying he just met the bare minimum. He was very good at all the other things as well. So he was fast enough to be a punt returner and a slot receiver in the NFL. But like as a 4.49 hand time pro day, like that's not world class blazing speed that really is the thing that got him there. But he was fast enough for sure. Obviously, if he's smaller, so we talk about being smaller, he was a smaller guy and he brought his strength up. I don't know exactly how many reps he hit on his bench press 225 test, but he hit a couple at least. And so he was very strong for his size, but he wasn't like one of the strongest kids on our team. So he met the threshold of being strong enough to be able to do what he needed to do. Same thing with whatever the other qualities are, but he just over indexed on making sure he was the quickest human being alive. And that's what allowed him to play at the NFL. And so I would say the same thing for you here. You want to develop strength to be strong enough to where it's not something that's going to prevent you from doing what you need to do, but don't over index on just strength development at the expense of trying or at the expense of your speed development. So we see that actually a lot where a small kid is so focused on getting stronger that he puts weight on and he actually loses a step of speed. And now the thing that was getting him playing time before, the thing that was his superpower, is no longer present. The good news for you, if you're young enough, actually for most people in general, if you're asking this question, the answer isn't either or. You're going to be able to do both. Getting stronger is going to help you get faster. So the second part of that question is focus on getting stronger, Make sure you are still doing your sprint work, making sure you're still developing as much speed as you possibly can. Those two things will both improve together, but don't over index on just adding mass and gaining size without without focusing on speed development as well. The first part of that question there, though, what's the best way to train to get stronger without just getting bigger? I'm not exactly sure what they mean by that part of the question. So we just lift weights, hit a squat, hit a squat pattern, a press pattern, a hinge pattern, a row pattern, 2 to 3 times per week for years on end, and you will end up in a good place that you need to be.
Yeah, I
Any
mean,
thoughts?
lift heavy, good things happen. But I love this question because I think it went back to our conversation we were just talking about kind of keeping the main thing. And like my immediate thought there was like, I mean, especially when you get up to those upper levels, you see guys who they are elite at one or two things. They're not always the biggest and the fastest, but you're sure that they are the fastest, or you're sure that they are the biggest. So just kind of my
Yeah,
thoughts there.
your LeBron James of the world are not the norm. Like LeBron James is great at everything. Like that doesn't exist for most people. Your Calvin Johnson is your Calvin Johnson for a reason. He was great at everything. He was 6'5", ran a 4.3, changed direction, elite. Like you're not them. Like if you're listening to this podcast, I'm sorry, you're not them. Like maybe one of you who listen to this one day are, but like for the most part, you're not him. I was not him. Like most people are not him. You need to focus on getting good enough to play, getting all your physical attributes good enough to play at the level that you want to play at, and then over index and just absolutely dial in on one superpower, make that your thing. So I played Division I football. I had a good career. I was tall enough. I wasn't absurdly tall. I was tall enough to play safety at the level I need to play at. So I hit that box. Thankfully, God gave me some genetic blessing there because my dad's 5'6", my mom's 5'3". The odds were against me. I was able to get to 5'11 and 3/4. So I was tall enough. I was like 190 pounds, 190 to 198 pounds throughout my college career, varying. So big enough, not crazy big. I was fast enough. I could run a full laser was like a high 4.6, low 4.7, which is faster than you guys think. So on hand times, whenever I was coming out of high school, I was a high 4.4 guy. I changed direction. Okay, not elite, but it was good enough to be able to play at the level that I needed to play at. I was strong. I was very strong, but that wasn't something that allowed me to really thrive on the field. At some point, strength, as a safety, isn't going to be something that is a huge blessing. Like I was pound for pound the strongest kid on the team going into my senior year at Akron, but like I'm playing safety. It doesn't really matter that much. At some point, that strength didn't really transfer. The thing that allowed me to get playing time, the thing that allowed me to have a successful career was that I knew more than anybody else on that defense. Like I was an absolute tactical savant in a way. It sounds extraordinarily arrogant, and we're gonna run that back and delete that because I don't want that out in the world. But the thing that allowed me to get playing time was I was very good tactically. I understood the X's and O's. I knew where people were supposed to be. And so that allowed me to pick up my playing speed because I was able to anticipate things better than other people were. And so just find out what your natural inclination is toward and then double down on that, but bring everything else up to at least meeting that threshold of, hey, I'm good enough for that level.
Isn't there a video of you hang cleaning 315 out there somewhere?
338. Come on now.
My bad.
Don't cut
My
me
bad.
short. 338.
Never.
Never.
All right. I think we were pretty good on that question, so we'll roll into the next one.
Let's
And
get it.
here we have a 16-year-old golfer, and they're saying, my low back is always hurting from swinging so much in one direction. What are the best exercises to fix that imbalance and to help me build more all-around power?
Just so you people know out there, I copy and paste these from our submissions into here, and I don't prep for these questions whatsoever. And so every fiber of my being wants to just skip this question and go to a different one because of the words low back pain. Low back pain is the bane of my existence, and any healthcare practitioner who works with athletes will probably agree with that statement. Low back pain is incredibly challenging, it is incredibly common, and it is incredibly difficult. Not for everybody all the time. Some low back pain can be very simple and straightforward, self-resolving, but it is the most complex musculoskeletal issue that I deal with, and I feel pretty confident that anybody who works in a similar capacity will agree with that. I put out a newsletter a couple weeks ago that actually was this past week, whenever we're recording this, that talked about low back pain. And I'll throw the graphic up here. Low back pain is incredibly difficult to diagnose and deal with because of a number of different factors, and so there could be like psychosocial, emotional factors involved in it. It's an area of the body that's very congested, so you have a lot of different tissues that are in the same area right there. So a lot of different muscles overlap each other. You've got bony issues, you've got ligamentous issues, variety of different fascial issues. And then the biggest concern, though, is actually not the biggest concern, but one of the bigger concerns is the nerve density that's in there. And so, if somebody hurts their ankle, the nerve distribution is pretty isolated. We get a very pinpoint signal. If I press on this structure, then I'm pretty sure that if that hurts, that's the structure that hurts. So, if I press on the anterior talofibular ligament and that's a place that hurts, I'm like, okay, you probably have an ATFL sprain. That's pretty straightforward. Whenever you get further away from the body, you get more, we call that distal. We get pretty clear cut signals from the nervous system. In the low back, however, everything converges together. And so we have a very chaotic signal, very chaotic noise distribution that makes it more difficult to figure out what the pain driving source is. So I say all that to say, I don't know, based off of the 2 sentence question, why your low back is always hurting. So I'm not going to leave you actionless. No, my first thing I'm going to say, and this goes for the entire podcast, is none of this is medical advice. Please go see a healthcare practitioner. This is not medical advice for you or your athlete. But I'm not going to leave you actionless. Here are some things that this theoretical person could do to try to help address some of this. And so you're thinking it's coming from the imbalance. We want to make sure we have more anti-rotation capacity. So if you're constantly rotating, we need to develop the anterior core structures to be able to prevent some of that rotation stress from going into your bony structures in your low back. And so anti-rotation exercises are probably the first thing I'd make sure you implement before you train every day, before you practice every day, and really try to dial down. Those would be Palloff presses, Palloff pulses, cable chops. We do about 600 million different types of Palloffs in the facility, and I think you can attest to that, John.
Yep.
But yeah, so that would be the first thing I'd make sure we do, making sure you have enough rotational capacity to both sides. So that way you see a lock lumbar rotation screen, see do you have enough thoracic spine rotation to the right and to the left. If you don't, then making sure we address some mobility deficits. I would start by just addressing the lats with some soft tissue work and some band lat mobility, just because the lats are normally the biggest limiting factor with T-spine rotation capacity. And then also follow that up with something that's going to load through that rotational range of motion to both sides to kind of work on some strength development, to quote unquote fix those imbalances there. Those words are kind of yucky to me. I don't really enjoy the words of fixing imbalances. We're naturally asymmetric individuals as human beings, and so imbalances are going to be very natural. But I'm going to use the terminology that was used in the question. So some cable thread the needle, some band thread the needles are things that I really have a strong affinity for. So those would be my first go-tos. I would say, hey, make sure you're crushing some anti-rotation core work. Make sure that you're addressing soft tissue work to the lats, doing some lat mobility, and then loading through that rotational capacity with some band or cable thread the needle stuff. When it comes to the power side of things, the all-around power, I wouldn't really do anything else from a rotational standpoint if you've already got low back pain from swinging so much. Whenever we have a rotational sport athlete who is heavy in season, I do not add to that rotational sport. I have a pretty strong stance that we as human beings are not designed to rotate as often and as violently as some of our sports demand us to. We've evolved for running long distances. That's how we succeeded early on in our ancestry, was for running long distances. And so sports that align more are just running based. And so your soccer sports, things like that, are going to be a little bit more natural. Our violent extension rotation sports like softball, baseball, golfing are a little bit less natural to our biomechanical tendencies. And so I don't want to add more extension rotation stress on whenever they're already doing a lot of that in season. So during the winter, whenever you're not golfing as much, I would really hone in on some med ball rotational power work bilaterally, do it with the right hand, do it with the left hand. So that way you can build up some less asymmetry. But during the season, from a power standpoint, I would add a lot of jumping because that hinging pattern is the same exact pattern that you're going to do whenever you go to swing a golf club. It's the same hip extension pattern. So there's some translation that goes from the weight room into the uh, onto the course there. But yeah, I wouldn't intentionally try to add rotational power through rotational mechanisms while you currently have low back pain from swinging so much.
Yeah. I that one kind of caught my eye just thinking of that low back pain. I mean, obviously it's something that we see and I know how much it's not fun to deal with when we see it. Um, but just the idea of kind of those rotational sports being so much more violent than our typical like running sports. I was just curious, this isn't one of the questions. Is it more likely for you to have an athlete who comes to you with low back pain if they're playing one of these rotational sports? Baseball, softball, golf versus volleyball, basketball, soccer, football.
Yeah, no, it definitely is. The only thing I'd say is volleyball is rotational sport, so that falls under the other category as
Mm,
well. Volleyball is heavy rotation. Volleyball is a very unique sport where it's a jumping sport and a rotational sport. So it requires a very unique set of demands. You have to train a volleyball player like you train a basketball player and a softball player combined because of the arm demands from swinging and the jumping demands. But yeah, there is an absolute strong correlation between playing these rotational sports and low back pain, significantly higher in softball than any other sport. I've joked plenty of times that if someone open up a physical therapy clinic in this small area of Greensburg, Pennsylvania, and just focus on softball players, you could actually make that business work because softball players get hurt way more than any other sport that I've ever seen. That's multifactorial. One of the reasons is they specialize incredibly early. They're playing year round softball from an incredibly young age. The second thing is when I say year round, I mean year round. They'll take like a month off and they'll be like, yeah, that was my off season. I'm ready to go again. That's not natural. You should have at least 4 months out of the year at the bare minimum where you're not touching anything softball related, especially whenever you're, I mean, all the way up until at least your middle high school career. So once you get to about halfway through high school, you should have a very prolonged time off. But yeah, so it's the same thing with baseball, same thing with volleyball, same thing with golf. We just see it. Those extension rotation sports are more prone to having extension rotation injuries, which are the most common type of low back pain that you'll see in adolescent athletes. So an older adult is more likely to have flexion-based low back pain, meaning they're gonna bend forward. Their pain's gonna hurt more whenever they're bent forward. They're bent over. Maybe they hurt themselves picking something heavy up with their back grounded or something along those lines. Whereas adolescents are more likely to have extension-based low back pain, where it hurts more to extend backwards. And so, anytime an adolescent has extension, rotation, low back pain, we have to have our ears perked up to be concerned about some sort of spondy developing, so some sort of bone stress injury, which can lead into a spondylolisthesis, which can eventually lead into spondylolysis. And now we're in pretty dangerous territory if that's the case. And so we have to be able to differentiate between muscular based low back pain, which is something that's not fun and it doesn't feel good, but it's relatively benign, meaning that you're not going to escalate it into something worse versus bony low back pain. If you have a low grade bone stress injury and you keep pounding on it, that low grade bone stress injury turns into a spondylolisthesis, which then turns into spondylolysis and is a dangerous route you don't want to go down. So we have to be very vigilant about, hey, if we have an adolescent who has low back pain, this isn't something that's normal. We have to address this. We have to make sure we figure out why this is happening before we just continue to push through it.
got it. All right, I think we're going to move on to our next question and we're going to stay in the softball realm. So this question says, I'm a senior softball player and I think I'm totally burned out. I have no energy and I don't even enjoy playing anymore. How do I tell my coach and my dad that I need to take a break without them thinking I'm quitting?
Oh boy, are we opening up a can of worms with this one, John? Because
Yep.
I fear that this is more the norm than it is an anomaly. Softball is a huge burnout sport, primarily for the reasons I mentioned in just the last question. I see more burnt out softball players than I see burnt out players from any other sport. They specialize incredibly early, they play year round, and they get injured very frequently. It is not a system that's well designed right now. I have more issues with the current softball system than I do any other sport, and I love our softball girls. Like, I want to see them be successful. They love their sport so much whenever they're young, and then when they get up into their later high school years, they're always just like, "This isn't fun anymore. I don't enjoy this." So, this person's recognizing that, and I think that's very, 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 very valuable. So kudos to you for recognizing your burnout. Now, how do you go about having that conversation? You are a senior, and so now you have more grown up like tendencies. You're probably 17 or 18 years old, and so this is a important time of your life to learn how to have real world conversations. You are your own person at this point in time, and so you just need to be direct. And I would go to your dad first. I'm assuming your dad is going to support you. It might be challenging. I know there can be some parents who aren't so supportive of such things, but most parents really love their kids and just want to see them be happy in this life. So you just have a conversation with them, tell them what's going on. And then I don't know what your situation is from a recruiting standpoint. If you're someone who wants to play in college, if you're like, hey, I really do love softball, I think, but I just played too much of it. Maybe you're at a point. If you're a senior, you might already have your college options on the table. And you're just like, I just want to finish out my spring season. It's the fall right now. I don't want to play fall softball. Um, and I don't wanna do anything throughout the winter, like, that's okay. Just have that conversation with your dad, and then you can go have that conversation with your coach, and if your coach has an issue with it, that says a lot more about your coach than it does about you or your dad or anybody else in that situation. If you are trying to play college softball and you are going into that college softball situation already burnt out, that's only going to escalate once you get there. The college game is only going to get more challenging. It's going to get more businesslike and it's going to get more demanding. So I think it's a good idea to give yourself a reset before you get into that situation. If you're somebody who doesn't want to play college softball and you just want to, because you said you want them to um, not think that you're quitting, which means that you're going to go back to it. So if you're a senior, you only have one season in high school left. So I'm assuming that you want to play this last high school season. You just want the fall and winter off. Then just have that conversation with your coach and your dad. And I think that there shouldn't be any negative repercussions with that. And you can just really go into your last season of high school and enjoy it. But yeah, and so the biggest thing I would say is just be open, be authentic. Don't sugarcoat it and try to make it seem like it's not as bad as it is. Because just if you're very open about how you're feeling, if you're feeling this way, then they need to know how burnt out you are, how much you don't enjoy it, how you have no energy. The more you try to kind of play it off, the less they're going to understand your perspective. What are your thoughts there?
Yeah, I think one of my favorite things about sports is how it gives just young people the opportunity to have real and authentic conversations. And I think this is a perfect opportunity for this person to exercise that right. Obviously, this is a situation that is uncomfortable. No one wants to come to grips with the fact that they don't love their sport anymore, or that even that they're feeling burnt out over their sports. It's a hard thing to kind of come to. But I think use this opportunity to find out sometime something about yourself. Like are you going to handle this situation as a young adult? How are you going to use this to kind of just use it as another opportunity later in life to say, hey, I dealt with something kind of difficult. I've already had an uncomfortable conversation with someone who I care about and who I care about their opinion. Why can't I do this next hard thing? So just kind of take this as an opportunity to learn and grow and put it in your toolbox for later whenever more things come up.
I love it. I love it. I couldn't agree more. I think that is one of the most important, valuable things of an athletic career is to learn how to navigate life after athletics and become a functional member of society. So I couldn't agree more.
Yeah. All right. I think
All
we
right,
have time for one more on this
let's get
episode.
it.
So we're taking it to a fun conversation of ACL surgery. I'm
All
a few
right.
months out from my ACL surgery, and I'm scared to cut and jump again, even though my knee feels okay. How do I get over the fear of re-injuring it and trusting my body again?
It's a really good question. It's something that's relatively misunderstood within the ACL world right now. And so we have something called um, the ACL RSI. So the ACL RSI is a subjective measure where you state how confident you are in your ability to return. That should be a staple in just about every return to sport protocol for an ACL participant, because the less subjectively ready you feel to return to your sport, the more likely you are to get hurt when you return to your sport. So we need to address this head on. And the answer that I've found to be the most effective is just simply graded exposure. So what does that mean? Graded exposure means to expose you to it gradually over time in small increments. So we start with something that's really easy, something really low intensity, and something that's really comfortable for you to get integrated back into. So instead of having you start out by running as fast as you can and cutting 90 degrees, it's like, okay, we're going to start out with some line drills where we do a linear jab and you go 50%, and we just have you put that foot right out in front of you. It's like, okay, hey, you're able to push off the foot. Good. All right. Now let's eventually we'll progress into a very light 50% jog, and we'll go a 45-degree cut, which is a very acute angle, which is very low stress. And so it's you're going 50% speed with a very acute low intensity cut. It's like, hey, I can do that. And then gradually build up over time. We build out very extensive return to agility progressions for our return to sport athletes, because you have to be intentional about the loads that you put on them, not just from a biomechanical perspective. Yes, that matters. We need to make sure that those tissues are slowly being exposed to higher and higher levels of force so that way they don't get flared up. But the cognitive aspect of it is so incredibly valuable as well, because if you are apprehensive, you're not going to perform well and you're going to put yourself in dangerous positions. My safeties coach at Akron used to always have this saying that you can't tell the difference between a scared athlete and a confused athlete on film. They look the exact same. They both stand there, they're both hesitant, they're both moving very rigid, very stiff. And that concept applies here. You can't tell an athlete who's scared from an athlete who just isn't physically ready to do those things. And so we need to make sure we slowly integrate you into all of these exercises, and eventually you're going to realize, oh, I already did this, so I can do a little bit more, and I can do a little bit more, and I can do a little bit more. And then all of a sudden you're lining up against somebody reacting to them going 100%, and you feel great. And so graded exposure is the biggest thing. Make sure you have a physical therapist who can comfortably build out progressions for you to go from very low level intensity plyometrics and change of direction stuff to very high intensity stuff where you're reacting to somebody and have some sort of cognitive stimulus as well.
Yeah, I think coming back from injury, obviously hard. I know, like, just speaking for myself, even at the high school level, coming back from those shoulder surgeries, you never really feel the same. Even if you know that you are, your body's telling you that you are, your doctors are telling you that you are, there's definitely that mental hurdle of, I know something's different, even if no one else does. But I think
Mhm.
that that's where just getting those small wins and stacking those and building up that kind of like that toolbox again, just that evidence that you can do this, even though like maybe you don't feel like you can, just like intrinsically in the back of your head, stacking those small little wins is really helpful for stuff like that.
Yeah, for sure. For sure. All right. So I think we have to cut it there for today. We are going to be back at it next week. We're going to turn this into a weekly endeavor just because I like talking to John so much. I want to make sure I can do that on a regular basis since he ran away and went to Villanova. He doesn't live in Greensburg anymore.
Just
Um,
misses me so much.
so much. But yeah, so we'll be back at it next week. In the meantime, if you don't subscribe to my newsletter, please go to gtperformance.co/newsletter. Again, that's gtperformance.co, not .com. I can't afford the .com. Like, like $30 to $50,000 for gtperformance.com. So we had to go gtperformance.co/newsletter, and you can subscribe there. I have revamped the newsletter recently where every week you'll get some quick blurbs about something related to the mind. So that can be something that's mental processes, understanding how to develop goals, get you in a better mental state. Something about the body, so that can be pain, rehab, training, performance, jumping, whatever it is. And then something about the soul, something for you to reflect on to make you a better human being each week. So they're short, they're easy to read, they're going to be less than 5 minutes, but they're going to be packed with a lot of value. So go ahead, subscribe there. Just as a reminder, everything today and on these episodes now and in the future is not medical advice for you or your athlete. If you have any questions, we're going to put the link in the show notes and you can ask them there.
There we go.
Until next time, anything to add, John?
No, I think you hit it all.
All right. Until next time, go be great out
straight A
there.
student, but I'm friends with the cool kids. Following the rules and the rubric. Freestyle on the bus and it's too late.